Right, so we are live here. Hello, everyone. We have today Dr. Chetan Jha with us, who is a senior consultant and in-house doctor with Apollo Hospital. Today, we're going to speak about a topic on newborn care, which is very near and which everyone wants to know more about it. So, we have a doctor with us who would explain us what are the different things that we should take care of. To talk something about a Dr. Chetan Jha, he is a senior consultant with Apollo Hospitals. He is a neonatologist and a pediatrician working with them at Indirapuram Center. Doctor, it's all yours now. We would want to know more and more about childcare. Thank you so much.
Okay. So, hello, good afternoon, everybody. So, today I will be explaining you regarding newborn care. In newborn care, there are many myths that we face regarding breastfeeding, regarding say neonatal jaundice. So, and there are many more. So, just I will explain you what we all need to do with babies. They are newborns, है ना? So breastfeeding is first and foremost thing that we need to follow. So there are many challenges in breastfeeding, but what we recommend is exclusive breastfeeding for first 6 months, and there is no ifs and buts on that. So for a term baby, there is term baby and babies who are born with say more than 34-week gestation. There is no issue starting with direct breastfeeding immediately after birth. And babies who are born less than 34-week gestation, okay, as there is say issues of coordination, sex swallow and breathing coordination, so we can have initially with say tube feed and later on with start with say breastfeeding. So breastfeeding is first and foremost advice that we need to follow for a proper development, proper nutritional and neurodevelopmental development of your baby. So this is regarding breastfeeding. Then comes to temperature maintenance. So temperature maintenance in case of newborn is very important. So hypothermia is a major issue that is very important immediately after birth and later on as well. So what we need to follow is room temperature should be around say 25 to 27 degree temperature, degree centigrade rather, and whenever mother feed her baby, baby's mother should touch baby's hand and feet. It should be warm to touch. So how much clothes do newborns require? So that is, it's almost say 1 or 2 layers more than any adult. So regarding temperature, hand and feet should be warm to touch. At the same time, there should not be any sweating. So overcovering at times can lead to high temperature. So we have to strictly follow these advices. Then comes regarding say urine output. So initial 3 to 4 days, baby can pass the stool, pass urine 3 to 4 times. That is okay. After that, 6 to 8 times minimum urine output is okay, and that means every 3 to 4 hours baby do pass urine. So this is like say monitoring urine output is very important, as it will give you an idea that whether baby is getting a good amount of feed or not. So this is one parameter of adequate breastfeeding. So regarding stool frequency, it is quite variable. Baby can pass the stool say after each feed or once in 3 to 4 days. So both these extremes are normal. At times, when baby is on breastfeed, exclusively breastfeed, even 5 to 7 days can happen between two stool frequency. So regarding the stool, nothing major needs to be done most of the time, and color of a stool may vary. That could be say black, yellow, green, but blood in a stool is always abnormal that we need to follow. Then regarding cord care, in cord care, nothing should be applied on the cord, and it should be kept clean and dry. It will fell off say by 7 to 10 days, and after that you can clean it once with sanitizer. So one thing that you need to understand is there should not be any redness around the cord. So if there is redness, that means there is some sort of infection. Then you need to follow your pediatrician. So there should not be any discharge. There should not be any redness around the cord. So this is very important, as this is one side from where infection can go into the say newborns. है ना? So we have to take extra precaution with that. Uh, Regarding infection prevention, we all know that in COVID days, Hana, we have to be very particular regarding, say, preventing viral infection, because viral infection is very dangerous for such small babies. They can lead to, say, viral pneumonias and can lead to admission. So, more or less, this is what we need to do during routine newborn care. Nothing should be applied on the cord. Hana? Cord should be kept clean and dry. And regarding danger signs, what one should be very particular regarding feeding of the baby. Baby should take feed every 2 or 2.5 hourly. Demand feeding is ideal, but in initial days, baby do sleep for say 17, 18 hours a day. So you cannot allow baby to sleep for such a long period of time. So 2 and 2.5 hours, or even earlier, if baby demands, then you can give feeding. Regarding say rashes, there are 2-3 types of neonatal rashes that can happen. So nothing major needs to be done for that. If rashes are very alarming, then you need to consult with the doctor. You should be very particular regarding urine output of your baby. It will give you an idea that baby is getting good amount of feed, perfusion is fine, and baby is well rather. So, and above all, weight gain should be proper. So weight gain pattern for a newborn baby is initially 5 to 7 days. For a term baby, 5 to 7 days baby loses weight, then they start gaining weight, and it is birth weight by say 10 days, and after that baby should gain weight at a rate of 30 gram per day. So this is what we all need to be done. Now, jaundice is a very common problem in newborn babies. We should follow. We are following, say, American Academy of Pediatrics chart for jaundice management. So sunlight is not very say. Sunlight is not required for any treatment of jaundice. So for that, we need to have say special blue lights, and that needs to be given at a distance of 30 to 50 centimeter. So what we need to do at home for prevention of jaundice, exaggeration of say physiological jaundice, so we have to feed baby very timely, and there should not be excessive weight loss that can lead to say increase in jaundice level. So this all that is required. Initially, baby needs to be immunized at the time of birth. That we all do. After that, first vaccination. There are various schedules, but mostly we do at say 6 weeks of life. We start at 6 weeks of life and then follow accordingly, monthly basis. So this is very important. So. Uh, So regarding breastfeeding, there is a question: how long should the breastfeeding be done? So breastfeeding for a term baby, 10 to 15 minutes from one side and 10 to 15 minutes from other side is quite okay. So after each feeding session, you should feel, mother should feel that breast is empty, and it should be done in a proper manner. So the main problem with this breastfeeding is at times baby do sleep at the time of say after doing 1 to 2 suckling. So we have to wake him or her up, and there should be effective suckling for say 10 to 15 minutes from one side and 10 to 15 minutes from other side. Some Regarding color of the stool, what is the question first? Color of the stool, it varies. As I have just told you, it can be say black, that is color of meconium, then golden yellow, then pale yellow, then green, CD. Frequency of a stool also can vary. Baby can pass the stool say after each feed, or once in 3 to 4 days, at times 5 to 7 days. That is also normal if baby is accepting feed well. So, and color of the stool that needs to be say reported to is say blood in stool is always abnormal. but at times there may be in female babies there may be some vaginal bleed. That is quite okay, that is quite normal in first say 10 to 15 days. This is because of maternal hormones, that is withdrawal bleeding, so nothing needs to be done for that. So if blood in stool, then you need to say follow your pediatrician, and there are many reasons to be ruled out then. So regarding vaccination, birth vaccination should be done as early as possible for a term baby, and for preterm babies before discharge, vaccination needs to be done. And precautions regarding vaccination, we need to say follow routine schedule while doing vaccination. That is, as per Indian Academy of Pediatrics, we follow 1.5 month, 2.5 and 3.5 month, then 6, 7, and as routine thing. So we have to follow that vaccination schedule. And after vaccination, at least say half an hour, we shouldn't give any milk to baby, and preferably if baby remains in say clinic or hospital for half an hour post vaccination, that is very good, so you can follow any changes or any difficulty. Regarding storing of breast milk, so breast milk, you can express your breast milk. You can put expressed breast milk in say steel container, and that can be kept in the chill tray, okay, and freeze rather, and you can keep it for say 24 hours. Regarding say at room temperature, 3 to 4 hours milk is quite okay. So before providing that milk, that needs to be say that needs to be warmed with warm water bath, so this is what we need to do. Regarding kajal, applying kajal to eyes is not at all recommended. This is the only reason by which we can say prevent neonatal eye infection, ophthalmic infection. Massage to baby we can do. So massage, like say massage with say coconut oil, olive oil, almond oil, but this should not be, we should not use any say strong, yeah, like say mustard oil or any other so massage can be done. So that there is nothing against it, but it should be gentle massage, and supervised tummy time you can give during massage. So but what we need to follow for first 1 year is baby should be sleeping on back and not on abdomen. 10 top childcare instructions we should follow. So, ma'am, breastfeeding is first and foremost advice that needs to be followed. Then temperature maintenance is very important. And regarding temperature maintenance, we used to say put many layers of clothes. That is not required most of the time. So 1 or 2 layers extra is quite okay. And bottom line is baby's hand and feet should be warm to touch. At the same time, there should not be any sweating, or you don't have to take temperature. But if baby is warm, then first and foremost thing is you have to remove clothes. If it is say too much layers is on the body, then we should be very watchful regarding urine output. Baby should pass urine at least every 3 to 4 times, every 3 to 4 hourly. That is 6 to 8 times minimum. After say 3 days, before that even 3 4 times urine is quite okay. So this is important. Then regarding prevention of infection, we should be very careful. We should avoid public places. We should avoid giving children to some say infected ones. Viral infection, that is very say normal for an adult person, but is very difficult to manage at times for small babies. So infection prevention, and especially during this COVID time, we have to be very particular about. That's all mostly. Regarding bathing of child, it should be after 7 to 10 days. One cord falls off, and cord is completely dry. Then only you can. Cord is completely dry, no discharge, no redness around the cord. Then only you can start with say bathing. So regarding bathing, the best thing is it should be there should not be any water in eyes or ears. You have to prevent infection as well, and at the same time you have to clean your baby's body, so no added say sanitizer or Dettol or any Savlon, nothing should be applied. First 1 month, no cosmetics. So plain water, plain lukewarm water, you can do bathing with, and you can do it on a regular basis. So daily, that is required. Initially, for 7 to 10 days, when you don't start with bathing, you can sponge your baby with say lukewarm water and towel, soft towel rather. Is there any questions, please?
No, sir. Right now, we have not got any questions from you. So we can conclude the session.
Okay.
You also can conclude the session from your end, sir.
Thank you.
Thank you, sir. Thank you so
Yeah.
much.
Thank you. Yeah.
I will end the broadcast. Thank you.